Dr. Talks. Today we are going to discuss about breast cancer. To discuss more on this, today with us Dr. Bushra Khan. Dr. Bushra Khan, breast cancer surgeon, consultant, Star Hospital, Department of Surgical Oncology, Hyderabad. Doctor, can you explain what is breast cancer and how it develops?
So first we look at what exactly is cancer. So in cancer, what really happens is that there is an abnormal multiplication of abnormal cells, which is not under control. When this phenomena takes place in the breast, it is what is called as breast cancer.
Doctor, what are the different types and stages of breast cancer?
So when we look at breast cancer, it is commonly known as carcinoma. Now what exactly is carcinoma? When cancer develops in the epithelial cells that line various body organs, then it is called as carcinoma. Now the different types of breast cancer that we see, the most common one is what is called as invasive ductal carcinoma. IDC also has many types under it. Other than that, there are two main divisions when we look at it. One is called as in situ carcinoma, when it is limited to the ducts and lobules of the breast, and invasive, when the cancer cells, they outgrow, get aggressive and enter into the normal breast tissue. The different types of cancer, if you look at it, you've got invasive ductal carcinoma in situ, inflammatory breast cancer, and metastatic breast cancer. Other types would include angiosarcomas of the breast, thyroid tumor of the breast. Coming to the different stages of breast cancer, you've got stage 0 to stage 4. Stage 0 being when the cells are limited within the ducts and lobules of the breast, and stage 1 onwards when it starts spreading into the normal breast tissue. Stage 1, 2, 3 and stage 4. Stage 4 is what is called as metastatic breast carcinoma, where it spreads from the breast to different parts of the body. So one thing good about breast cancer is that especially stage 1, 2, 3, when diagnosed and detected early, are curable. Definitely the cure percentage comes down and the chances of recurrence increases, but they are still curable. Stage 4, with the recent advances in medicine, is controllable, but however, not curable. So the main thing with breast cancer that you need to pay attention to is early diagnosis and prompt treatment.
Doctor, what are common risk factors for breast cancer?
Risk factors for breast cancer, definitely starting with gender. Breast cancer occurs in both males as well as females, but females have a preponderance definitely to breast cancer because of dense and bulky breasts. Alcohol consumption, excessive smoking, or even smoking and tobacco consumption is a huge risk factor for breast cancer. Obesity and increased weight gain is a risk factor for breast cancer. Next, you've got something which is called as early menarche and late menopause. Early menarche means early onset of your periods, and late menopause means late delay of the periods. Why is this a risk factor? Because the number of years that you're exposed to the hormones estrogen and progesterone in your body increases, which increases your risk for breast cancer. A very important risk factor for breast cancer is a family history of breast cancer, whether it is your first degree or second degree relatives, whether it is your maternal or the paternal side. Having mutations in the BRCA1 and 2 genes is also a huge risk factor for breast cancer, with increased incidence and increased risk over the years.
Doctor, are there any lifestyle changes and preventive measures that can reduce the risk of developing breast cancer?
Definitely. So what can you do to reduce your risk of cancer in general? I always advise 6 main points to reduce your risk of cancer in general. What are these main points? Number 1 is eat healthy. Number 2 is avoid alcohol and tobacco consumption in all forms. Number 3, stay physically active, any version of your active. Number 4, get adequate mental and physical rest. Sleep and rest is an adequate part of health and good health and avoiding the risk of cancer. Number 4, vaccinate when you are advised. And number 5, take part of screening camps and be aware of what is going around the awareness campaigns for cancer. As such, for breast cancer, definitely avoid smoking, avoid alcohol consumption, keep that weight in check, do not go towards obesity, be physically active, be aware if you have any relatives or any first degree or second degree relatives with a history of breast cancer, and very importantly, take care to be a part of breast screening programs. One thing which is very important for an early detection of breast cancer is something which is called as breast self-examination. Stand in front of the mirror, look at your breasts, observe what is your normal and examine yourself. How do you actually examine yourself? You examine yourself with the pulp of your fingers. You examine all the quadrants of your breast in sequence. But do not do this every day. Do this every 15 days so that if there is a difference, if there is any lump, any nipple changes, any discharge, any skin changes, any skin wound which is not healing, you are able to detect it early and come in immediately for a physical examination.
Doctor, what are the main treatment options for breast cancer and how they will be determined?
So very importantly, you've got treatment options that range from surgery, chemotherapy, radiation therapy, immunotherapy, target therapy, and hormonal therapy. As I told earlier, there are various stages of breast cancer, stage 0 to stage 4. It is mainly the stage and the type of breast cancer that determines your treatment. Whenever we take a biopsy of a lesion from the breast which is suspicious of cancer, we send it for something which is called as IHC markers, immunohistochemical markers, which are estrogen receptor, progesterone receptor, HER2 receptor, and the Ki67 proliferative index. Depending on these four, we have another division of breast cancer into 4 types, which is luminal A type, luminal B type. You've got HER2 positive breast cancer and triple negative breast cancer. A lot of these factors are together used to determine what kind of treatment you need first and how to go about your treatment. Coming up to it, it could be chemotherapy first, followed by surgery. It could be surgery first, followed by chemotherapy, radiation therapy, subsequently hormonal and immune therapy.
Doctor, can you explain the role of surgery, radiation therapy, chemotherapy, and targeted therapy in breast cancer treatment?
Very importantly, with the recent advances that have come about in medicine, we have surgery which has made great strides. Earlier, whenever someone was diagnosed with breast cancer, there was a concept that the breast has to go. We have to surgically remove the breast. However, this is not done nowadays. We follow something which is called as breast conservative surgery, or BCS. What do we actually do in BCS? We remove the part of the tumor which has got cancer with a margin surrounding it, and we send it for testing to confirm that this is appropriate. Another thing that is done with breast conservative surgery is something which is called as the sentinel lymph node biopsy. Sentinel means the guard. Okay, so what happens is when your breast cancer it starts to spread, the first thing that it goes to is what is called as the sentinel node, which is in the axilla. So now what happens is we detect it using the ICG, indocyanine green method, and we send it for a frozen section intraoperatively. In the frozen section, our pathologist, our in-house pathologist, is able to report within 20 to 30 minutes whether that lymph node contains cancer or not. If 3 sentinel lymph nodes are positive for cancer, only then do we go ahead with an axillary lymph node dissection. Why is this so important? It is important because axillary dissection increases the morbidity of the surgery. So, if axillary dissection can be prevented, it will prevent further complications of surgery like swelling of the arm, which is commonly called as lymphedema. So definitely, breast conservative surgery versus mastectomy. Mastectomy means complete removal of the breast. And nowadays, research has shown that patients are doing very well with breast conservative surgery, and the overall survival has improved with breast conservative surgery. Next, coming to chemotherapy. Usually, if the tumor is small, then we initially go ahead with surgery depending on the IHC marker profile of the patient. However, sometimes chemotherapy is needed before surgery. Then, if with a curative intent we are going ahead with it, it is called as neoadjuvant chemotherapy, or NACT. Definitely, there are many advances and a lot of research which is going on for breast cancer, and there are new drugs which are coming up which actually improve chemotherapy. What exactly is immunotherapy? Immunotherapy, put in simple words, helps to boost your immune system to fight against cancer. You've got a drug which is called as pembrolizumab, which is nowadays being used for immunotherapy. Then what exactly is target therapy? Target therapy is also called as precision medicine. Like I told you, we've got IHC markers, a marker called as HER2. If that is HER2 receptor, if your breast cancer is HER2 receptor positive, you can use certain agents like trastuzumab, which blocks that receptor and it slows down the multiplication of the diseased cancer cells. Hormonal therapy is as well there for ERPR, that is what I told you, estrogen receptor, progesterone receptor positive cancers, and it is advised for them once they are done with chemotherapy. So depending upon the type, grade, mitotic index, IHC markers, your treatment modalities are discussed and they are planned accordingly. Also, radiation therapy. If you undergo a breast conservation surgery, radiation therapy is a must. They are nothing but waves of radiation which are given to irradiate the remaining breast tissue to prevent any chances of recurrence and further spread.
Doctor, can you discuss about recent breakthroughs and advancements in breast cancer?
So like I said, there are many advancements and a lot of research work which is going on the chemotherapy, immunotherapy, target therapy front. And doctors, the research doctors, they are working tirelessly to actually come up with modalities of treatment which has made breast conservative surgery, like not removing the entire breast and preserving the breast and only removing that tumor, possible. In surgery, definitely, we've got breast conservative surgery, and in order to make the cosmetic appearance of the breast appear as normal as possible, even after a bulk of the tumor is removed, there is something which has come into being called as breast oncoplastic surgery. Breast oncoplastic surgery ensures that even if 50% of your breast volume has been removed, there is a way to reconstruct the breast. You've got volume displacement and volume replacement techniques available today.
While breast cancer is more associated with male and female, so what can be the awareness part for the male breast cancer? Is there any gender specific campaign?
So definitely we've got, as I told you earlier, being a female is a risk factor for getting breast cancer. But that does not mean that men are spared. Male breast cancer is also on the rise, and men need to be aware that breast cancer can occur in men as well. I don't know if gender specific campaign is what we need to do, but we generally need to spread an awareness among both men and women that breast cancer is the most common cancer in the world, and they also need to be a part of campaigns like screening and self-breast examination to detect any lump or any abnormality in a male breast early.
Doctor, if patient find lumps during their self-examination, how they need to take it forward?
Suppose a patient on self-breast examination detects a lump or any abnormality with the nipple or any wound over the breast which is not healing or a swelling in the axilla. Please do not panic. That's the first thing I would tell any person, any patient. The best thing to do is to go to a physician or a specialist and get yourself examined clinically. Suppose on clinical examination, they also find something. If you are below the age of 40, we will get a sonomammography done. If you are above the age of 40, we will get a mammogram done. Depending upon the mammogram, we will have an idea if the lesion is suspicious of cancer or not. The next step that we come to is a biopsy. There are two main kinds of biopsy that we do. One is a fine needle aspiration biopsy, commonly known as FNAC, and the other one is the core biopsy. A core biopsy is a slightly more invasive procedure which is done under local anesthesia, but the advantage is that we get a much more thicker tissue which can then be sent for IHC markers and testing in detail. Depending upon the final report of the biopsy, which comes in a span of 1 to 2 days, the patient will need an evaluation whether the cancer has spread throughout the body or it is limited to the breast or it has spread from the breast to the axilla. The next thing we do is ideally a whole body PET CT scan, which will help depending upon your clinical history. We will assess if that is needed or not, and we will be able to determine the stage of breast cancer, which ranges from stage 0 to stage 4. Accordingly, after all the reports are available, like I told you, stage 1, 2, and 3 are curable, and stage 4 with the recent advancements is controllable. So accordingly, the treatment modality will be planned, whether you need surgery first or chemotherapy first. What exactly is going to be the sequence of treatment that is best for you will be decided by your doctor. So please do not be scared. do self-breast examination, detect any sort of abnormality early, and show up to a physician or a specialist immediately.
So I think we have covered all the questions related to breast cancer. If you have still doubts, kindly mention in the comment box.